Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Thank you, everybody, for joining us today. My name is Gladys Hunt, and I'm actually a certified health education specialist, and I have been leading many of these programs on the community since about 2016. Also the current Health Equity Liaison and Community and Patient Engagement Lead for the Tennessee Heart Health Network. So to kind of get us kicked off, I would love to hear from you if you are currently a lifestyle health coach or a community health worker. So for those of you who are not a health coach, I'm going to break this out into 4 buckets because for me, I had to kind of think of it that way. So the first thing that we would need is to have a lifestyle training and certification program. And then we have lifestyle self-management programs. And digging a little deeper into it, we have the DPP, and lastly, this diabetes self-management program. So I'm going to be talking about all 4 of those. With the first one, the lifestyle training and certification program, just very, very briefly, I did want to show you some of the options that we have in the state. Starting shamelessly, talking about our very own UT-HSC's health coaching certification, which is led by our very own Dr. Susan Butterworth. This is a program that is a 2-part, starting with the motivational interviewing. Anybody familiar with the motivational interviewing
Yes.
piece? Okay. Yeah, perfect. And then the second piece is a chronic lifestyle management program. So the motivational interviewing program, is asynchronous. It's all online, interactive. It takes about 10 to 12 hours to do it. It's 6 modules long. You usually do it with a partner, which is really the best. If you have somebody that you're starting out with in your office, you can do it. If not, you don't have to. But then you practice with a partner, and then you end with a competency assessment. Then the chronic condition lifestyle management, the second piece of this, is also about a 10 to 12-hour program that is online. And this one is 4 modules. And this the part of it is a case study as a competency assessment. And so it's really a highly recommended. I've done several of them, and I love that program. Again, you can see our website. You can go into it if you have any other questions or you want to sign up for it. The next lifestyle training and certification is a very intense one out of Vanderbilt. Dr. Ruth, I can't think of her last name, but the link for them is there. And this program is approved by the National Board for Health and Wellness Coaching. And when I say intensive, it is an 8-month long educational program that has 25 online learning modules. And then you have peer discussion, and you have facilitated practice. So it is a longer program. This one has another part of it that includes a practicum. And so each participant needs to complete 70 hours of documented health coaching sessions. And then you have to pass a skill exam. And then you have a final course exam. So, and that one it's a great program. The third one is another program that UT, Vanderbilt, and Lipscomb have come together to kind of develop the content. And it's the Preventive Health Network, led by the Coalition of Better Health. And it is focused on behavioral health behavior changes preventive activities, communication, health promotion. And this one is about 12 weeks long. With about a total of 40 hours. Again, this is all asynchronous. You know, things used to be different before COVID, but since COVID, most of them have are all asynchronous, or at least have some portion of it that is. And then you have live virtual training. You can see the contact for that if you are interested in that piece. Any questions so far? Okay. You know, again, these are only a few of the program because I know there's more. Specifically, I'm thinking of the DTAC, and I'll talk about that in just a minute. So then for the next piece, I'm going to highlight, and then I'll go into more detail, but I'm going to talk about the lifestyle self-management programs. And these include, you know, we focus a lot on diabetes, of course, in our state, but these are more than just diabetes program. This include, you know, anything from asthma to any kind of chronic disease. And the two programs that I'm going to talk about today are MEND and the self-management program resource center that used to be called Stanford, if you guys have been around for a long time. And if I say Stanford, this is the program I mean. I was there when it used to be called ASK, so I kind of sometimes forget. And then we're going to talk about the DBP, for type 2 diabetes. And this is specifically just a prevention program. And lastly, we're going to talk about 3 other programs that are diabetes self-management education programs. I was telling Julia before we started, I had a few others that I was going to discuss, but there were some changes and some legal issues that have not been ironed out. And so we will see more and new and more programs discussed probably early January 2025. So for now, I'm going to just stick to this 3. So lifestyle management programs. Okay. When you hear that, what do you think? Anybody wanted to tell me what you guys think this entails? Anybody put it on the chat if you're shy.
Just more kind of health coaching.
Yeah, exactly. And so, like I said, that's exactly right. So this one in particular, this is a new program, at least to me. This is called MEND, and it stands for Mind, Exercise, Nutrition, and Just Do It. It is overall health, lifestyle self-management, not diabetes specific. So this one has more to do with weight, and I'll go into a little bit more, but it's a 10-week core program with about a 2-year maintenance and support. And it is for the entire family. So I love it that I know for our some of our health hubs, this would be great to integrate the entire family into it. So this program, we are trying, the State Department, listen to me. The health department is trying to increase the number of counties where this is being led. And so I know that, let me see if I can find the counties. I've got them somewhere. So yeah, so this is really the Department of Health is partnering with the UT Extension to focus on some of the priority populations, including children between 6 and 13 that are overweight or with a BMI that's 85 percentile or above. And the children or children's with family history of obesity in Harding, Haywood, Henderson, Madison, and Shelby counties. So I think these are some of the counties that we're going to be seeing the expansion of this particular program. The next one that I mentioned, the Self-Management Resource Center out of California, there is a slew of programs with this one. It started, I think it's been around since about 1996. And it started out, they're all evidence-based. All the programs I'm discussing today are evidence-based. So the first one on the list, the Chronic Disease Self-Management Program, in the equivalent in Spanish, Tomando Control de su Salud, is like the first one that came out. And based on that research, they have created other ones. The next one is a workplace chronic disease self-management. And then you have the diabetes. Oh, I think I listed this one twice. Okay. And then the next one is let's see which one. You have the chronic, yeah, that's what it is. The chronic pain self-management. It's really good for sickle cell. I've done it personally for sickle cell groups here in Memphis. And then you have the aging well with HIV, one for caregiving. And what I really like about this, that it's already in many languages. So you can see it's in Arabic, Danish, French, Canadian, Hebrew, and different programs, and of course in Spanish. So funny enough, I didn't put it in Spanish down there, the other language, but it is in Spanish. So specifically the chronic disease self-management for adults, it's called Living Well with Chronic Conditions. And it is a 6-week session for participants, and you do have homework and action plans. And I really enjoyed this particular program because it does encourage, when we talk about being self-management, one of the first things that we are asked as leaders of this program is the name tags, silly things like that you don't think about. We don't fill it out for them. The people are supposed to come in and sit down and write their own name. So that's interesting little things about this program. But again, you do get homework, you do get action plans, and every week you're supposed to ask them about their action plan and where they are, if they completed it, and so this is normally done by two leaders, I can't say that word, leaders, 2 people that are trained. And you get a book, you get a CD, and again, the equivalent to this is Tomando Control de su Salud. Any questions on this program so far, or anything that I've talked about so far? Go slowly. Okay. So next, to really focus our so we've looked at the lifestyle self-management programs, and now we're going to talk about DPP specifically. So diabetes prevention. It is to prevent or delay onset of type 2 diabetes. And this particular program meets the diabetes prevention recognition program. Anyone with pre-diabetes can join. Now, this is a more focused long-term program. It is 26 sessions in a 12-month period. So, there has to be a commitment from the patients, on the community people themselves. To get trained for this is through Emory University here in the state, and it's we call it DTAC, but it's Diabetes Training Technical Assistance Center out of the Emory. Like I said, it is a 3-day training, and I wanted to make sure I cover some of the. So during the first 6 months of this period, the goal is to reduce weight loss by 5%, and to have a reduction of the A1C in the 12-month period. Like many of the other programs, one of the biggest goals is to increase physical activity. And I stay away from saying exercise because I think that's intimidating to some people. But if we just say physical activity, that's it could be gardening, it could be dancing, it could be, you don't have to go to the gym to do the exercise. And for this particular, for the DPP, the last, so this first 6 months, it's 16 sessions, and you start out with, of course, the introduction, and the last one of the during the first 6 months, it's one called, trying to stay motivated to prevent type 2. And then the last 6 months, you have 10 more sessions. Go back. Any questions on this one? Okay. So then, as I mentioned, I already mentioned that. All right. So going back to the diabetes self-management education program, I think we're going to be seeing a lot of new programs that are already evidence-based, and we're going to be seeing more in starting January. There were some other ones that I had on my list, but I was told because of legal issues that to go ahead and not present them today. So I have 3 that I'm going to really talk about today. But before I even go into that, I kind of want to, because I want to go into a little bit, because we know that the Center for Disease Control, CDC, are the ones that created the standards. Okay. And they have recognized 2 different organizations to kind of manage and accredit the programs. So I kind of wanted to do it at a high level, and then we're going to break it down a little bit more. So the CDC has approved ADA and ADCES, the Association for Diabetes Care and Education Specialists, to manage all the programs. And I believe the next one, yeah. So in the state of Tennessee, these are the ADA recognized sites. And thank you to Lisa for sending me this information with the health department. You can go in and I'll share some of the links later, but you can go in and put in a zip code, and it will tell you where the nearest ADA recognized site is for your area, for your zip code. Similarly to that, there's one for the ADCES recognized site. And I think I looked, as of 2020, there were a total of 2,100 sites delivering DSME programs in the United States. So that's a lot of programs. I don't have the number for Tennessee. Any questions on that so far? Yeah. You guys stop me, because this is more, I wanted to make sure that I'm answering any questions. So the first of the programs that I wanted to talk about is the DSMP, is the one that I mentioned earlier out of the Stanford model that's done by the Self-Management Resource Center out of California. And it's called Take Charge of Your Diabetes. So the prerequisite for being able to lead this course, it's the one that I mentioned earlier, Living Well with Chronic Conditions, which is the lifestyle management. So you go through the training for the lifestyle management, the Living Well with Chronic Conditions, and then you have a additional piece to learn how to lead, that Take Charge of Your Diabetes. This training, the CDC used to support this financially, and so, but now the resources are very limited. So, if you are interested in this program, and it's a great program, we lead it here in Shelby County at our health hubs. I love leading those. They are, I think, as of last week, I heard that it was full for the spring, but you can get put on a wait list. They are offering one course in person in the Knoxville area, and then the virtual ones. Normally, this training, just like the Living Well with Chronic Conditions, are 6 weeks long. And so, any questions on this? The classes are just like the living well with chronic conditions are about 2.5 hours long. And like I said, they're 6 weeks and with homework and action items. The action items, they can be whatever the patients want it to be. And then for the ADCES training, there's another, they have different programs as well. They have the Diabetes Care and Education Specialist Certificate Program, the Diabetes Community Care Coordinator Certificate Program, and they have other trainings. If you're interested in any of these, let me know. I think Lisa has some information to sign up for these. And I just signed up myself for some of those. So the Community Coordinator Certificate Program is a certificate, just like it says. It's not certification or credential. It is a self-study, self-paced, and it takes, says 11 hours, but anywhere from 10 to 15 hours. It is designed for any kind of CHWs, health coaches, or anybody that's interested, including, I love this, the dental hygienist. You know how many times we go to the dentist, and I've had patients that tell me I was diagnosed, I was told to go check my A1C from my dental hygienist and my dentist. So I love that they're including that group here. So in the last program I wanted to discuss and share about, it's the DEEP program. And this is the Diabetes Empowerment Education Program out of the Midwest Latino Research in the University of Illinois in Chicago. This one's 8 modules long. It is recommended that it's done by facilitators. It can be done, I've done this one in either 6 or 8 weeks, as long as you cover the material. For the educators, it can be, this is the first one that I remember doing or learning about and taking the course, and it's a 3-day training. Most of the time, unless your organization wants to bring the University of Illinois to your facility, that the training is done in Chicago, or it can be done via Zoom. But this one you get certified for, I think, 3 years, and then you have to do a recertification. And I think that's the last one of the programs that I have for today. Yep. Before I go and say thank you to everybody, what questions do we have today? Questions? There's got to be questions. So let's talk for a minute then. I'd love to hear from you. If you are leading any of these courses, which ones, and you want to share a little bit about it?
Hey Gladys, I can share a little bit about it.
Yes. Hey, Anthony.
Hello, how are you?
Good, good.
So, I've done both the DSM and the DPP classes. Those classes are very, very informative as far as, the people you'll be coming in contact with. It kind of gives you a really good representation of just like I said, the people you'll be involved with, the things they need, um, and so on and so forth. It kind of gives you a real connection on the need that people have. Some people don't manage their diabetes well. Some people don't know about the diet. So, it's just a big array of things. And I think if you just go with the flow of the class, and kind of get them engaged, it can be a lot of fun.
Yeah. And Anthony, you brought up a really good point. There's different the community is so different, and everybody's got different motivational reasons for either not, wanting to stay, or prevent the diabetes, or stay healthier. And this is why I think I love Dr. Butterworth's piece on the motivational interviewing, because it really gets you to kind of discuss, and kind of work with the patients and the people in the community to find out, what's motivating them and why do you want to make the change? And it's not about me, it's about you. And this is a good opportunity for those that have not led any of these classes to ask maybe some of, Anthony, I'm glad you're here. Anybody else that would, any questions that you may have at all.
So the one that is through Vanderbilt, you said it was nationally accredited. Is that a certification, or credentials?
It is, you're talking about the lifestyle one, right?
It was
This one. Yeah.
Yes.
This one is it's a certificate, but it is really, really good. Dr. Ruth, and I'm trying to remember, I can get you her last name, is the one that leads it. And I've had her to speak in one of our patient groups before, so I cannot remember her last name, but I can get you that information, Julia.
Okay.
But like I said, that one's very different, because that one is 8 months long, and it, there's a lot of interaction. And then there's an exam, practicum and exam at the end. So, any other questions?
Hi,
You don't happen to
Gladys.
have a,
Oh.
I'm sorry.
I'm sorry.
You don't happen to have a, oh gosh, I hate this on Teams. Go ahead, then I'll ask her.
I'm sorry. I was just gonna say that I'm actually a new employee, so I haven't been trained in either of the courses yet, but I am scheduled to do the DPP next month. But I have had the opportunity to sit in on both the self-management and the prevention classes over here at Shelby Cares, and I thoroughly enjoyed the classes, and I'm really, really looking forward to getting trained and, being able to lead the classes. So I just wanted to say that.
Wonderful. I look forward to meeting you. I have not met you yet. So,
Yes, yes, yes.
Yeah,
Thank you.
Julia,
Could you show me that map again, please?
yes, ma'am. Okay. This one's for the American Diabetes Association recognized sites. And if you want, let me see if I can put the on the chat, or just go to it. Can you guys still see my screen?
Yes.
Okay. Because over here you can you go in and put in so that one came up with the other one. Okay. You can
So if I had physicians that wanted to start any of these, like I've got one physician who does some healthy weight, healthy you classes, and he's been running them, and he's just big on advocating, and he works with a group of residents. If I had someone like that who was interested in getting something like this started, do I just send them to you and say, hey, she's got all these programs that you could initially start, or how do I need to go about doing that?
Could, or you could look at in your in that link that I just put there. You can see if there are programs in the Chattanooga area that may be closer to them. I know that some of them are being done via Zoom now. I don't want to speak for our health host, but I know that there is some talk about providing some of these classes via Zoom. So if you can't find one through the ADCES or the ADA in Chattanooga, let me know and we can figure something out. I'm not making any
Okay.
promises because I'm not the one leading those or managing the group that is, but we'll make sure that something is, we can get people the help they need.
Okay.
Yeah, and this is the one for the ADA. And you can look over here. Oh, want that. You guys can still see my screen, right? So you can put in, give me your state, your zip code, not Julia, or one in Chattanooga.
37343.
313. And this is the program that
MEND is mind, exercise, nutrition, and do it.
correct.
Rachel, I wrote that one down.
Yeah, and that one is a newer program now. I can't find it. Here it is. Yeah. It's a newer program that I'm not as familiar with, but it is. I talked to the lady that runs it, and I love it because it's family. It's not just adults. It's not, we're seeing, especially after COVID, we're seeing a lot of the younger kids, especially that tender age, 6 to 13, that are getting heavier because they're, not every school is offering the gym or PE classes. And so this is for the entire family.
Well, an interesting fact is because their scores are lower in school due to COVID, they take out the PE to put in extra classes that help them to try to get ahead.
Yeah.
I didn't know if everyone was aware of that. And then, and I hate to say, during COVID, video games were so big. And so you see this huge draw to video games because that's what kids started doing. And that is almost like their lifestyle now.
Yeah.
And it is a real challenge to get them outside, because they haven't developed those relationships of, going down the street and playing.
Yeah.
So
that's exactly right. That's why one of the reasons they start calling the juvenile diabetes juvenile, because so many young adults are, the younger kids are becoming type 2. So, yeah, it's interesting how many kids are, coming home and because they don't have PE or coming home and just starting on their little game systems and not being outside, running around. So that's why I'm really excited to learn about this. I have asked for us to be trained in this one because I think it's going to be really interesting to involve the younger population.
Now, Gladys, didn't you say that one was only available in a certain area?
Well, this one, I know that the Department of Health is working with the UT Extension.
Okay.
And it is, as far as I know, they're expanding the counties in where it is being led. I am not sure if there's one. Let me see what the names of the county. I had them here somewhere listed. Let me look. I don't know if they're in your area, but that's not to say that we couldn't find somebody in the area that would go through that certification to lead those classes. Just know that from working with the health department, they are, I think, Harding, Haywood, Henderson, Madison, and Shelby counties are the main focus right now. So, any other questions?
I bet if they did some hemoglobin A1Cs on those 12-year-olds, they'd be really surprised how many people need it.
Yeah. I mean, and I think we're seeing that in the classes that we have led, and I have personally led. I have moms that have come in and say, look, I'm not diabetic or I may be borderline, but my 13-year-old, weighs 150 and he's, 5 feet and he's at risk for, and so yeah.
Yeah, and I just want to, I want to say this out to like Deatrice and Rachel and Anthony. I have a 12-year-old son, and he was in force sports. Like, we were going hard. And I mean, Taekwondo was 12 hours a week. And it was just, he had a lot of different injuries, he was pushing through and did his black belt, broke his foot. I pushed him through, and I was like, we need to stop all this and do some healing. So we stopped for 6 months, and he just kind of took a break and was taking it easy and everything. And we went and I took him to the doctor, and I told the doctor, I was like, listen, I want you to just screen him because he's adopted and he's African American. And I said, I need you to screen him for everything because I have no clue about his history. His A1C come back 5.7. So, and his cholesterol was 197. So I was like, well, looks like we're back into sports. And because he's in school and it's one of the level 5 schools, it's the only level 5 school in the county, and they are all about the testing. Anytime their scores drop off, they have to go into an extra class. And sometimes they can have like math 3 times a day. Like, it is overkill. He said, I'm so sick of math. But anyway, they'll do them 3 times a day, and they always take out the PE, always. Even the extra classes where the kids just get to go play in the gym and do stuff like that, they send them over for extra training. And so if you don't do anything outside of school, then your kid is just basically sitting all day for 8 hours, which is terrible for him because he's so hyper anyway. So had I not gone and done that, I probably would have waited about 3 or 4 more months to get back into another program. But we're back in basketball starting tonight. So, and I think it's just an awareness we need to help, and all these programs just teach more and more. But when you're working with someone setting up this program, keep in mind those ideas about what is really happening. And it's kind of hard when you don't have a child involved in the school system, and you really have to reach out to other people and say, hey, what are they doing? Because it's not like back in our day where you had PE every single day and you walk to school and you walk back, it's such a different world now.
Yeah. Interesting about that physical activity, but that, I think it's terrible with the youth right now. One of the things when I lead the classes, I ask, and I try to do this even if I come in for a substitute day, because I think so the physical activity piece is so important for not only diabetes, your hypertension, everything, honestly. So I ask one rhetorical question, and I ask people not to necessarily raise their hand because I don't want to know really, but I start out this one class and I say, okay, everybody, did you brush your teeth this morning before leaving your house? Okay. Everybody's going to say yes, right? I had one lady that was funny, and she said, no, I have to take my teeth out of my little container. I'm like, okay, I gotcha. But so everybody brushes their teeth. Why do we brush our teeth? Okay, this is like a real question. Why do we brush our teeth? To keep our mouth healthy, our teeth healthy. We want to keep our teeth longer. And so I will ask then, okay, yeah, so we're brushing our teeth. We're spending 2-3 minutes brushing our teeth before we leave our house, first thing in the morning. We don't even think about it. It's, a second, nature, just get up and brush our teeth. How many of us are actually doing any kind of physical activity? And of course, nobody raises their hand, and physical activity is for our whole bodies, not just for that small window, not for just our teeth. And so when I do the exercise or, the physical activity classes, I want to make sure that we can do things from chair, walking, just walking in place, anything that people enjoy doing. And the other thing that I like to kind of point out when I'm leading some of these classes is I'll ask, and depending on the age of the person, how many cars have you had in your lifetime? Okay. Some people are car people and they will say, oh, I'll change a car every 2, 3 years. Well, we change oil in the car. We put gas. We do maintenance on the car to keep the cars as long as possible. We get one body. How many of us are exercising or physical activity? So those are some good hints to kind of think about, and kind of let people think of physical activity in a different way. So anyway, I hope that has helped.
Yeah, I just tell my son, brush the teeth you want to keep.
That's right. That's right, right. I love this. Any other okay, I see Rachel. I see your question about that. Does MEND have a training? They do have a training. I have asked about that. Jessica is the one that's actually doing the training as well for that one. I think you have Jessica Taylor's email. I don't know if they're offering it to everybody just yet, but we can call and find out about that. Hopefully, in the next month or two, we'll find out some other programs that are going to be available in our state, and we can maybe update this list. But
And you're going to share these slides with us, or where the resources are? No, okay.
Right, absolutely. Yes, I will do that. I'm going to send them to Misa Carter. Just asked me for them, and I think she's going to put them out there. But yeah. With that, then, if there are no other questions, I will let everybody have 20 more minutes of your day.
All right.
All right. And thank you, guys.
So nice talking to you, Gladys. Thanks, everybody.
Yeah, always. Okay. Always. Thank you. Bye-bye.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.